Hello. Last month, OTA lodged a submission with the Australian Parliament's Joint Select Committee's inquiry into road safety. In that submission, we highlighted the important role Occupational Therapy Driver Assessors play in road safety. We noted that neither GPs nor generalist licensing testers based at state and territory licensing authorities are ideally placed to recommend or conduct driver assessments. This is because such assessments are most probably an occasional rather than a core part of their professional activity. In contrast, the occupational therapy profession has a long history of providing driver assessments and vehicle modifications and must complete specialised postgraduate training, ensuring they are highly qualified to determine medical fitness to drive. Among our recommendations to the committee, we urge the government to develop a clear and well-publicised pathway for GPs to refer any patient about whose driving ability they may have concerns to an occupational therapy driver assessor. Consider the establishment and funding of an independent medical and occupational therapy driver assessor staffed service to which GPs can refer patients for independent assessment. Create and fund a separate Medicare benefit schedule item for occupational therapy driver assessments to assist those who do not qualify support under existing programs. Recognise the widening disparity between demand for and supply of occupational therapy driver assessments and provide subsidies to ensure a growing number of qualified occupational therapists can undertake postgraduate training in driver assessment. Give greater and properly informed consideration to the needs and safety of non-driving road users. This should include the design and development of integrated transport plans in which public transportation, pedestrian ways and emerging transportation technology are rendered safe, accessible and convenient for the many groups in our community unable or unwilling to drive. This process should draw on the expertise of professionals trained in the facilitation of community access, among them occupational therapists, and implement a public awareness campaign to educate drivers about the need to reassess driving ability if legitimate concern exists as to a driver's competency. It is to be hoped that the committee members give consideration to these recommendations, ensuring that the considerable demand for driver assessments, which will likely grow as our population ages, can be met by appropriately qualified OTs. Our submission to the committee can be read on the OTA website. I would also remind you that driving is one of the key practice areas to be featured at the OT Exchange 2020 conference. This will be held in Melbourne on the 22nd and 23rd of June this year. Early bird registration for the conference closes on March 19th, so act now to secure your place at the conference at the discounted rate. Members of the Advocacy and Lobbying team will be attending the conference. We hope to meet you there.